Hello, and we talked about the 10 different common type of medicines, her example doses, her maximum doses per day, the route of administration, and common side effects that you have if you take it too much time. Okay, it's the second time I record the video because the first time I take it like 20 minutes and it's too much for this video and it's a short video. So we'll start. The first we have eight are anti-inflammatories, no steroids. Without steroids, we have ibuprofen or acetaminophen that help us. Sorry, just ibuprofen. That the common dosage is 200 or 400 milligrams two times per day, or sorry, 6 or 8 hours per 6 or 8 hours. The maximum dosage is 1,200 milligrams, or it can depend about the weight of the patient. The route of administration is oral. Some common side effects: stomach pain or stomach issues and ulcers if you take it too much time. The second is an analgesic, is painkiller too. It's a paracetamol. It you can take it 500 or 1,000 milligrams per day sorry every 4 or 6 hours. It depends what your doctor said. The maximum dosage is 4 uh, 4,000 milligrams per day or 4 grams too. And the route of administration is oral. You can take it intravenous too. All the medication I will say you can take it or you can be administered, sorry, by intravenous. The common side effects is liver damage if you overdose this from per much time, and you can have nausea too. Then we have an analgesic. Pardon, sorry. We have an antibiotic that is amoxicillin. Antibiotics have like 10 families. It can be divided in different antibiotics, but it's an antibiotic too. Well, then amoxicillin is a penicillin, is part of the penicillin class, and I want to say that you can take it 500 milligrams per day or 8 milligrams per day. It depends about the weight of the patient. Like I said before, and the maximum dose is 3,000 milligrams per day. In the recommendation of the normal, in a normal script that your doctor said. The route of administration, sorry, is oral. The common side effects is diarrhea, allergy reactions, and rash in your skin, like that. It's a kind of allergic reaction on your skin, the rash. Then we have an antihistamine, is for allergies, is loratadine, and we have like you only you only have to take it 10 milligrams per day. The maximum is 10 milligrams per day. Once a day is it's okay. Not too much because will can uh, can cause some side effects or can cause common side effects like drowsiness, dry mouth, headache too. Then we have bronchodilator like salbutamol is an example of them. You can this common dose of the salbutamol is 1 to 2 puff per 4 hours or every 4 6 hours, and the maximum dosage is 8 puff. Why I say puff? Because you are gonna inhalate this salbutamol with a helper with a in Ecuador or in the way I call this is chisguete. You are going to chisguetear this and gonna inhalate the air that liberates this salbutamol medicine. Okay, it can cause increase in your head hair in your breath rate, and also can cause you nervousness and shakiness. Then we have omeprazole, that is an proton pump inhibitor. Uh, you can take 20 or 4 milligrams per day. The maximum is 40 milligrams per day, sorry. And the route of administration can be oral or intravenous too, and it can cause you problems with your acid lactic activity, hemorrhage and low magnesium too, or digestive issues, or blurring or nausea. The anti-diabetic that we have, oh sorry, I skipped this. Anti-diabetic is metformin. The metformin help the reduce, sorry, reduce, help the diabetics with his conditions too. And you can take it 500 milligrams or 1000 milligrams per day, or every 8 hours, sorry. And the route of administration can be oral or intravenous too if you are using. Then we have benzodiazepam. Benzodiazepam is for depression or anxiety. We have diazepam as example. You can take it 5, 10 milligrams 3 times per day, but not much, please, because it's too addictive. And the maximum doses per day is 10 milligrams or 4 milligrams. You can take it in in an oral way or in an intravenous way. Then the common side effects of this diazepam can be drowsiness, dependency, and confusion dependency because it's too addictive. This type of medications. Okay, the hormone, we have different type of hormones as a medication, but we are going to focus in insulin that helps the glucose of that is our fuel of the body to go to inside of the mitochondria or inside the cell, the the functional unit of the human, the cell. Then it can depends the doses and the maximum doses per patient. Every patient have different doses. My grandmother have 10 international units per night and per day. Once a day is a maximum of if you have a problem with your too much sugar or too much glucose in your blood, you can take you can administer it 2 times per day. It can be intracutaneous, the route of administration, and that's all with hormone insulin. And then we have another type of antibiotic that is a macrolide that affect directly the macrolides affect directly the protein matching of the bacteria. If you block or destroy that part, the bacteria will die in like 1 day or 2 days. Then you have acetam- uh, azithromycin, azithromycin, like an example, and you have 5 milligrams, 500 milligrams daily for 5 or 6 days because you have to be constant and take it like per week. Like you have if a week have 7 days, you have to take it 7 days because the bacteria will have a resistance and can create a resistance, no, microbacterial resistance, like that. You can administer it by oral or intravenous. Then we have some different habits that can help you to increase or be better you your life, like I will mention 3 common life changes to be more healthy. Okay, I didn't remember the phrase correctly. I have to read it. Sorry. Balanced diet. Eat a balanced diet help you with more functional and and gain more nutrients if you eat the things you have to eat and the things you need. Because if you need junk food or trash food or fast food, that's the same things. But if you are going to eat too much and you are not gonna take the necessary nutrients about that food, do you know what I'm saying? Eat more fruits, eat more vegetables, eat like almonds or something like that. Things like that help you with to your body, and it's better for your cardiovascular health and other things. Then we have exercise regularly. Exercise regularly help everywhere. Everyone needs to exercise regularly because you are going to feel better, you're going to be fit, you are going to start breathing better because when you make exercise you learn how to breathe, and that helps you to your lungs and to your heart. Then you need to sleep more, sleep well or sleep more, like 7 9 hours. If you are a med student, you are not going to sleep well, but you are going to save lives. Okay. um that's all for me. I got these papers. That's this is my presentation. Thank you, Mr. for the attention, and have a good night. Bye bye.